To the member for Fisher.
Thank you, Mr Deputy Speaker. I rise in support of this bill, the Private Health Insurance Legislation Amendment Age of Dependence Bill of 2021. But, Mr Deputy Speaker, this bill is good news and it's bad news. As the father of 4 daughters, I can distinctly remember having the conversation with each of them that have gone on and become independent, and I'll use that in inverted commas, as any parent would know, about the merits of them continuing with their private health insurance. And each one of them that I've spoken to has complained bitterly about the costs that they once enjoyed for free on mum and dad's wallet to now having to look at having to fund themselves. And we all know, of course, that the more people that we keep in private health insurance, the better it is for everybody, and particularly young people. Of course, young people are, by their very nature, less inclined to need private health insurance because most of them don't get sick. But it's very, very welcome to have when things go wrong, and sometimes they go wrong badly. But I remember having a conversation with one of my daughters in particular who just said, "Look, Dad, I left home," and she was over 24, and she said, "I just can't afford to pay the private health insurance." The bad side of this bill is that we all know as parents, we're going to pick up the tab. We're going to want to make sure that our kids, whether they are dependent or independent, have that sort of health cover for as long as they possibly can for those parents that can afford it. So this is very, very sensible reform, and I'm very pleased to see that those members opposite are on board with this reform. Because, as I said, the more people, and particularly the more younger people we have in private health insurance, the better it is for all of us. It keeps costs down, it keeps premiums lower than what would otherwise be the case. Excuse me. So this reform will see people who are young people who are living independently. Living as dependents. Their age from 24 will go to 31 as to when they will be able to remain on the family health insurance policy. This will see a significant number of, I believe, of families, mums and dads, who will be able to contribute and help out, and maybe the young people will be able to help as well to pay for some of their own health insurance, because we all know that when you have a family health policy, that family policy will be far cheaper, even when you add an additional person to it, than what it would be if a young person had a standalone policy. Mr Deputy Speaker, one of the great reforms that comes out of this bill, which will impact upon tens of thousands of families, and I'm very pleased to say it will actually help the Wallace family as well, and that is for those families who have a disabled child. So these reforms will ensure that a child or a young person, a dependent who lives with a disability, will be able to remain on that family health cover, that private family health cover, for the life of that young person or the life of the dependent person who lives with a disability. Now, what does living with a disability mean? Well, clearly, in the first instance, anybody who's on or receiving benefits under the NDIA will be classified as someone who lives with a disability. But I understand that that definition could grow in time, and this is once again, very, very sensible reform, which I'm pleased is a bipartisan reform, that gives parents in particular, not the least of which also the person living with a disability, the sort of comfort that comes from knowing that the person who lives with a disability will have and enjoy the fruits of private health insurance. This is very, very important, particularly for people who live with a disability, so that they know that if they fall ill, they can choose their own doctor, they can choose their own hospital, and the time in which they will be able to access that treatment is usually much quicker, particularly for elective surgery, than what it would otherwise be if they were in the public health system. As the father of a young lady who lives with a disability, I can say that this will bring great peace of mind to parents. It's hard enough being a parent with a child of any age with a disability, but once a young person reaches the age of 24, without these reforms, then parents would more than likely have to pay for a separate standalone policy if they can afford it. Maybe they can't afford it. But this reform will enable parents to keep their disabled children on a family policy, and there will be significant, very significant cost savings in them doing so. So, Mr Deputy Speaker, I commend the bill to the House. Sensible reform. I thank those opposite for supporting this bill, and I once again commend the bill to the House.